Good evening, everyone, and welcome. My name is Courtney Wheeler, and I serve as a student body president at the University of Kentucky. I am pleased to be with each of you tonight. In March, the University of Kentucky began planning for the reopening of the fall semester. Administrators worked alongside faculty, staff, and students to come up with a robust plan and extremely thorough. Employees and students of the university have worked countless hours and thought creatively about how we can open to ensure the residential experience many students expect. The initial COVID testing for all students, physical distancing, wearing a mask, and doing your daily screening represents just a few simple ways we can ensure safety on campus. Following these healthy behaviors to remain safe will require the help of all of our fellow Wildcats. We must work together to maintain a healthy university. It takes sacrifice from all of us. If you are like me and have been on campus for many years, things look different. Our Wildcat community is wearing masks. We have tents on campus. We have a low capacity in our classrooms, and our dining halls are spaced out. But this is what we must do to remain safe and on campus. There are many things that tempt us: not wearing a mask, getting together in large groups without physical distancing, and wanting to hang out with our peers for the first time since March. But remember, we don't wear a mask for just ourselves. We wear a mask for our neighbors, best friends, and loved ones. If anyone is like me, I choose to wear a mask to be able to see my best friend who is immunocompromised. Unlike many of her friends, she feels safe around me because we both wear a mask and stay physically distanced when we're together. Wildcats, we must respect each other, protect each other, and do our part this semester to be able to stay on campus and have a healthy Wildcat community. I will now turn it over to the panelists to introduce themselves. Dr. Turner.
Good evening. My name is Kirsten Turner, and I am the Associate Provost for Academic and Student Affairs. I want to thank you all for joining us tonight. We want to spend the next hour or so talking about how the university plans to provide an avenue to your questions and provide answers for you. We've assembled a great team tonight who are all devoted to keeping the community safe. Last spring, President Capilouto asked the campus to prioritize safety, make safety easy for you and for our faculty and our staff, and return to a residential experience that we all believe in. This means all kinds of safety, not just physical safety, which is critically important, but also emotional and psychological safety as well. One of the areas I'd like to spend a little bit of time talking to you about tonight is the student services, both campus footprint, where you can come in and see somebody face to face with a mask and with appropriate social distancing, but also in the virtual. So we've reconceptualized our academic advising, our counseling, campus recreation, the ways in which we do student organizations and programming, residence life, and even the study. So we're all here to help you have a great academic year 2021 in a way that's safe and in a way that provides the residential experience that we all believe in. I'll now turn it over to my colleague, Nick Kerwald.
Good evening. My name is Nick Kerwald. I'm the Acting Assistant Provost for Student Wellbeing. I'm also one of the project leads for UK Health Corps. What I wanted to just talk about tonight is just some of the reopening plans related to testing, our tracing, as well as our screening. And I think there are quite a few questions as it relates to student compliance. And so with testing, last week we started our initial testing for all students. That initial testing will go all the way through August 22nd. It has gone, I think, for the first week, last week, very successfully. We've seen a number of students who scheduled appointments and register show up. And so we've had a great rate of completions. I know there have been ongoing questions beyond the start of the fall semester as it relates to ongoing testing. And so one of the things I wanted to talk about is the University of Kentucky has anticipated that we're going to have ongoing testing needs. We've been working with our partners in University Health Service to make sure that we have testing capacity throughout the fall semester. And we will also look at whether that means continuing our partnership with Wild Health, who's assisting us with our initial student testing on campus currently. As it relates to faculty and staff testing, I know there have been some questions from students around faculty and staff and whether they're required to get testing. The institution just communicated at the end of last week that we are opening up employee testing for our faculty and staff, and so that we will simultaneously over the next 2 weeks allow our employees to have voluntary testing on campus as well. Another or additional question as it relates to testing is there going to be mandatory or required testing throughout the fall semester? Our START group, which is led by our Dean of the College of Medicine, Bob DePaula, and that group is continuing to evaluate whether we need to have ongoing testing in the fall or what's called surveillance testing. I think they will, in the coming weeks, continue to make a recommendation to the institution and to our Emergency Operations Center. And so that is still being decided. So what happens when students get initially tested? And one of the responsibilities of the UK Health Corps is around doing that notification of positive results and then subsequently doing the contact tracing related to individuals that might have been in contact with those who have tested positive. And so we have a group of case managers and contact tracers that are central to our UK Health Corps that are making those calls currently to students who have tested positive during this initial testing phase. Negative results during this process are being communicated electronically. Again, I know there's been an additional question about perhaps students who haven't heard back or haven't seen any messages related to their test results. I would encourage everyone to check their university email. And again, they might think about what their filters are because they might have a test result that's gone to their spam. And so again, I would just encourage people to check those things. Of course, another option is you can always call UK Health Corps. The number to the Health Corps is 859-218-SAFE or 859-218-7233. We will be happy to answer that call if your result has come in and communicate that to you. So what does the process look like, I think, for students who have positive results? I know there have been a lot of questions about this, and so hopefully I can provide some clarification about different parts of the process. The university continues to partner with Fayette County Health Department. And so for our students who test positive, they are asked to isolate. And by asked, it's really, they are ordered to isolate. That isolation order comes from both the institution, but that will also come from the health department. And so if you are staying in Fayette County, that will come from the Fayette County Health Department. For students who decide to go home and potentially isolate at home, which again is an option. I know that's been a question that several students have asked. That local health department will work in terms of following up with the students and doing those isolation orders and subsequently the release from isolation. So what does it mean in terms of isolation? It is exactly that, that you are to stay at home and not go to work, not go to classes, not go to school, and not to have any contact with any other individuals. Again, we are partnering with Fayette County in particular, who is assisting us in doing the daily monitor and symptoms evaluation. Our role in this process is really assisting in terms of, in addition to our case managers and contact tracers, we have another position that we've called wellness connectors. And these individuals are really calling students to follow up with them about any needs that they might have during this process. Isolation can be very scary. It can be scary to be notified that you're COVID positive, but there also just might be emerging or attendant needs that a student might face, including whether that's food or laundry or technical needs, if that's an internet connection or device, and a host of other issues. And so our wellness connectors that are part of our core UK Health Corps team follow up with students to make sure that they can have what they need to be successful during the isolation period. Again, our hope is that for students who have to isolate or quarantine, that they are in the same position when they get released from isolation as quarantine as they were when they entered. So we want to make sure that we can allow students to continue to be academically successful and that being COVID positive doesn't require a student have to withdraw or separate from the institution. I think another really important distinction, isolation is for those individuals that are COVID positive. We have an exposure protocol, and working with our partners in UK Healthcare and Fayette County Health Department are using the CDC's community-based exposure protocol. I think you heard from your student body president, Courtney Wheeler, talk about some of the health behaviors that are really, really important. Again, that includes your mask and face covering, and that also includes physical distancing. And so exposure to someone who is COVID positive means that you are within 6 feet of an individual for 15 or more minutes. And so that is why, like I said, that physical distancing is so important. And so for those individuals that have been exposed to someone who's COVID positive, we have quarantine orders. And those quarantine orders basically last 14 days at a minimum from the date of exposure. And so I know there's been lots of questions, can I go get tested? If I get tested and I get a negative test result, will that override, the quarantine time period? And the answer is no. There's a time frame with which, those presenting symptoms for COVID might occur. And in addition, if they do present, then there's this infectious period. And so just to be really, really safe and through the guidance of the CDC, individuals who have been exposed are required to quarantine for 14 days. Quarantine is very similar to isolation. Like I said, we will have our wellness connectors follow up with students, make sure that we're providing the appropriate resources for students who are in quarantine. Similar to isolation, students can go home. For our on-campus students, they can stay in their residence room. But again, either of those options are available to students. The university screening for students will go out the first day of class or next Monday on August 17th. That will present in a mobile app. And so every day students will receive an email and text about doing that screening. And again, that's one of the really, really important health behaviors. So for individuals who might be symptomatic, of course, our hope is to get those individuals tested and to have students get the resources that they need so that we can stop or mitigate the spread on our campus. I think there's been lots of questions as it relates to student compliance around all of these different health behaviors. And so I will just start with masks or face coverings. Students, faculty, and staff are being asked and required to have masks on UK's campus this fall. I know in partnership with our Office of Student Conduct and Dean of Students office, that will also be a requirement for in-person classes. We have partnered with our faculty, with our Senate Council Chair and various other people in assisting our instructors and faculty and as well assisting our staff in terms of how to engage if a student doesn't have a mask or face covering. I think the earlier comment about how do we make, complying with health behaviors easy, we're obviously providing to all students and employees 2 masks. For students, they're receiving a wellness kit, which includes those masks, a thermometer, hand sanitizer, and information on accessing health resources at UK. We will additionally have masks and other PPE available across campus. So again, if someone forgets to have it, how do we make compliance easy? And so how do we make sure that it's available when someone may have just forgotten? That being said, it is an expectation that you will have a mask in terms of in-person instruction or in terms of accessing student support services on campus in a variety of academic spaces. For those that can't, we will ask them and look at how we might provide a virtual or remote experience for those students. In terms of testing, we are asking all students and are requiring students to be tested for the beginning of our fall semester. And there's multiple ways that students can satisfy that initial testing. Again, from an institutional perspective, we're asking all students to do the PCR viral testing. You can do that 7 days prior to arriving on campus and providing that test result through your health portal. The directions are on our website in terms of our frequently asked questions related to testing, tracing, and screening. Again, we're obviously also making available testing to all students as they arrive on campus. A couple of really interesting or specific things or nuances in this initial testing. We will have students who have already tested positive for COVID. And so using CDC's guidance, we are not asking those individuals to be retested if they've tested positive in the past 90 days. We would just ask students to provide those test results and any isolation release to the institution to satisfy that initial testing requirement. In terms of our initial testing, whether students submit that information to the institution or whether they get tested through our partner Wild Health, we will be tracking initial student testing. We will continue to communicate and encourage students to make appointments and register and get tested. But ultimately, we will follow up as it will be a requirement for face-to-face instruction living on campus or for individuals that will be coming to campus this fall. As it relates to screening, I've already talked about why screening is so important in terms of asking all of us to really check in on a daily basis about our symptoms and how we're feeling. Again, that's really helpful so that students who do potentially have symptoms can immediately get tested, can quarantine until they get their test results, and potentially really stop or mitigate any additional exposure to other individuals on our campus. Again, that screening, you will receive text messages and emails. That process will continue to escalate. So for those students who haven't completed it, you will continue to see communications through both of those different platforms, and ultimately may receive phone calls and follow-up. Again, that health behavior is really important as we think about stopping the spread of coronavirus. I think there's another big question is about how to address large gatherings. Ultimately, we understand how important it is to connect with your friends, how important it is to see other people when you come back to campus. But again, that physical distancing is so important as we think about the spread of the virus and when we think about our exposure protocol and how we think about the virus spreading. So again, I would encourage everyone to not have large gatherings. It is one of the fastest ways that the virus will spread and will ultimately really work against us to staying open this fall. In terms of situations or individuals having large parties, our code of student conduct applies off campus. So the University of Kentucky has been in partnerships with the City of Lexington and our Lexington Police Department, and we will accordingly respond to those situations through our Office of Student Conduct. Much like, and again, those large events are really serious as we think about the potential exposures and think about how quickly the virus can spread. So that is something that our Office of Student Conduct and the institution will take very seriously. And I didn't say it previously, but similarly, there are no options as it relates to isolation orders and quarantine orders. It is really important for students who have COVID, who have potentially been exposed, to follow those orders. And again, as I talked about our wellness connectors and how we're connecting the appropriate resources, we will try to make it as easy as possible to abide by those orders in terms of providing all of the necessary resources. Because again, ultimately that is really important for us. I think those are all of the things I wanted to talk about as we think about the testing, tracing, screening and compliance elements. I will say another aspect of our UK Health Core is really thinking about how we have an integrative approach to wellness on our campus. And so, again, as we think about our ongoing testing and how we have University Health Services assist us in terms of providing that for our students throughout the fall semester, we are simultaneously working with partners and thinking about how we have and create spaces on campus. And so working with our partners in facilities, how we continue to put up tents and allow those spaces and those opportunities so that students can be appropriately physically distant on campus is really, really important. Again, working with our partners in wellness and having student ambassadors. Again, how do we have masks and single-use PPE on campus and make it really, really easy to comply? Again, that's really been one of the philosophies that we have, but ultimately, we are asking for a little bit of sacrifice. It will take giving up, going to large events, and having some of those interactions that we would really, really enjoy and that might be typical so that we can keep everyone safe. And so with that, I'm happy to turn it over to our Interim Dean of Students, Dr. Trisha Clement Montgomery.
Good evening. Thank you, Nick. So as Nick said, my name is Trisha Clement Montgomery, and I'm the Acting Dean of Students here at the University of Kentucky. I was specifically asked to come here today to talk to you a little bit about how we are going to be walking through or how we will have our living experience here on campus. So here, living on campus in particular, many of you have probably already participated or will be participating in our 9-day move-in experience. So typically move-in has always been about 3 days, but this year it's going to be 9 days. And the reason for that is that we wanted to make sure we provided social distancing as well as facilitating a contactless process for move-in. So it's meant to keep everyone safe as they move into our residence halls. Once you move into the residence halls, I know one of the biggest questions we received is, what does visitation look like? In regards to visitation, students from the time that they move in until September 7th will go through an in-hall visitation process, meaning you'll be able to visit each other within the residence halls, but you will not be able to go to other residence halls and visit within that window of time. The reason why we chose to do that was that it would really be helpful if during that time students went and got tested. It gives them an opportunity to receive their results once they get into the residence halls. And then it just also gives you an opportunity to adapt and get used to this new and reinvented environment. And so we want to give everybody an opportunity to get settled, connect with their roommates, talk a little bit about how they intend to facilitate the cleanliness of their room or roommates, things of that nature. After September 7th, the visitation lift will be uplifted. And what will happen is students will be allowed, UK students with a valid UK ID will be allowed to go to other residence halls and visit their friends or guests that live in other residential facilities. So if you have a UK ID, you will be allowed. What that does mean, though, is that if you do not have a UK ID, you will not be able to visit the residence halls. In regards to common spaces, we've also received a lot of questions about this. But in regards to the common spaces within the residence halls, all of the common spaces are open. Laundry, kitchen, things of that nature are all open. The only thing that we ask is that students wear their mask in public spaces within those residence halls, and that they also clean down or wipe down the area, more specifically the kitchen, if they're going to use that particular area. But all common spaces are open to every student within the residence hall for use. And then lastly, we also received a lot of questions about, what does engagement look like? I can assure you that engagement is still our main priority, and there will be a combination of both in-hall and virtual programming. RAs are still expected to do one-on-ones with every resident within those facilities, and those particular one-on-ones, as well as community gatherings, will take place virtually. But there will also be programming both inside the hall and right outside of the hall that students will also be able to participate in. And so students will be able to take advantage of things such as the hammock garden that the university has created, as well as being able to do different programs that are also contactless within tents that are already set up here on campus. So at this time, I think I've walked through pretty much everything that there is to know about living on campus, and I'll turn it over to my colleague, Dr. Corinne Williams.
Thank you, and good evening. So I am faculty in the College of Public Health and part of the Health Corps team, and I wanted to spend just a couple of minutes letting you know about a survey that we've been doing. I'm actually going to give you some preliminary results and let you know how we're thinking about these in relation to the healthy behaviors we should all be practicing. So last Monday, we launched a survey designed to gather some information on what the members of the UK community were thinking about COVID-19 and health behaviors in particular. This was sent to a random sample of undergraduate students, graduate and professional students, faculty and staff. And I will say, even though I'm going to give you some numbers tonight, the survey is still open. And if you haven't completed it, please do so. It's really important to hear from as many people as possible. And we would like your responses. I'm going to go ahead and say a reminder was sent on Friday, and they had the subject line, University of Kentucky COVID-19 Attitudes and Behavior Surveys, so you can help to find it a little bit easier. And we've had a couple of questions about this, so I do want to just clarify, the survey is anonymous. We use the link blue only to make sure it's members of our UK community who are completing the survey. I promise your identifying information is not in any way connected with your survey results or responses. So for these results, I'm going to focus primarily on what our undergraduate students reported, mostly because from the comments that I have read, there were lots of concerns about how this group in particular would act. So first, one of the most important health behaviors is wearing a face covering while out in public. I'm happy to report that 77% of undergrads reported that over the past 2 weeks, they always wore a face covering while out in public, which is amazing. Another 18% reported that they wore one most of the time, with a couple of exceptions. That's 95%, which is, if we can do that while we're on campus, that's great. We did ask that same question for on and off campus, how you were planning on acting. 80% said you would always wear one on campus, and 78% said you would always wear one off campus. These numbers are important because we also asked you, how often do you expect that most people at UK will wear a face covering in public? Only 15% of undergraduates said always, and that number dropped to 9% among faculty. What I personally take from this is that so many more of you are planning to wear a face covering than others expect. And really my charge to you is to remember that 80%. If you see someone not wearing a mask, remember that they are a small group of people on campus. The overwhelming majority of our community members are planning on wearing a mask all of the time. Don't let seeing someone who's not wearing a face covering change your plans to always wear a mask on campus. I know that it can be difficult. I will say we asked some follow-up questions and people mentioned being physically uncomfortable while wearing a face covering, as well as it being difficult to communicate while wearing one. These things really shouldn't stop us from doing what we all know will keep us safe. So I would recommend there are a few different styles of face coverings and other things that you can do to make wearing them more comfortable, things like the ear guards. And I would really encourage you to look into these if you are struggling with wearing a face covering. One of the other things that we asked was, how confident are you that UK's plans for a reinvented campus will limit the spread of COVID-19? If we look at all groups that were surveyed, 43% of the UK community said they were at least moderately confident, but that number is 56% among undergraduate students. And I think this number is related to what I just shared about wearing face coverings. I've read a lot of the comments, and I will say a couple of you actually commented you didn't think anyone was going to read them. I promise you we are in fact reading them. A common theme was that the plan was good. They believed in the plan. They didn't trust undergraduates to do what we need to do, to wear the face coverings and to physically distance. And I would say, given the high numbers of you reporting that you were always planning on wearing face coverings, both on and off campus, I think you have a real opportunity to prove everyone wrong here. You've stated that you're planning to wear the masks, and I think you just need to make sure you follow through. We have put together a training as part of Health Corps that will soon be available to all students. But I did want to share just a few tips and ideas tonight related to the healthy behaviors that we all should be practicing. One thing that I know is going to come up, if it hasn't already for you, is what if people aren't doing what they should be doing in terms of these health behaviors, not wearing a mask, not physically distancing, et cetera. I want to make it clear that you have the right to to share your personal boundaries with others, and to have your boundaries respected. If someone is increasing your risk of contracting COVID-19 by not wearing a face covering around you or sitting or standing too close to you, you absolutely have the right to politely ask them to wear a mask or face covering or stand a little further away. I also want to make it clear, this is not the same thing as yelling at people across campus or policing others not in close proximity to you. We want to focus on you and your risk. I would also encourage everyone to start practicing saying things like, I see you're not wearing a mask. It would help me feel safer if you would. Are you willing to put one on? I will also say, practice saying things like this out loud so that you're ready when you have to say them in real life. We often will think them and sort of rehearse conversations in our head, but it's much better to say them out loud. I realize it sounds silly, and it is a little bit silly to sort of talk to yourself in that way, but you can also practice with a friend if needed. In the survey, we asked how confident you were in your ability to wear masks around other people and how concerned you were about pressure from others changing your behavior. While 77% of you said that you strongly agreed that you feel confident in your ability to wear masks, only 46% strongly disagreed that you were concerned about pressure from others. This means a lot of you were concerned about pressure from others changing your behavior. So we really want to think about how to address that. The numbers were lower for physically distancing. Only 42% of you strongly agree that you were confident in your ability to physically distance. And I think because that number is so low, I really want to encourage you and challenge you to think about fun ways to be social with your friends while still maintaining that physical distance. I know that this is really hard and is a different way of doing things than you expected, but only by always wearing face coverings when both on and off campus in public, and by physically distancing, will we be able to keep all members of the UK community as safe as possible. 60% of you strongly agreed with the statement, being a member of the UK community is very important to me. I would just say, let's all do our part to keep this community healthy and safe this fall. And with that, I will turn it over to my colleague, Christine Harper.
Thank you, Corinne. Good evening. I'm Christine Harper. I'm the Associate Provost of Enrollment Management, and we're really excited to have you coming back on campus soon and get things fall rolling. In my area, we will in Funkhauser have, as Kirsten pointed out, kind of dual modalities that we're working with. We will have in-person appointments and students can come in. We're only opening one desk, so we'll have everybody who wants to see anybody in financial aid or the registrar or has any question about applications and such come into the room 100 and then have appointments in one area. Some of our units will be taking online appointments and phone calls during that time, and we'll have in-person too. So we're trying to be able to make sure that we can provide you all of the resources and services to get any questions or issues resolved as best as possible. So we're really excited to be back on campus. We started back about 2 weeks ago, and it's good to be back in the building and kind of connecting with our staff family on campus too in advance of students coming back and working with us. So in our area, I think one of the areas that maybe having a big question that has been coming about is relative to the registrar's office in terms of working with our faculty and the colleges in courses and modalities. I think the biggest thing, as we've talked about, and a number of us have talked about, is the health and safety of campus. And so a significant amount of time was spent over the summer looking at all of our classrooms and how different they are and what the capacities could be so that we could offer a residential experience and a face-to-face in-classroom experience, as well as some hybrid opportunities and online opportunities for students. With over 10,000 different sections of courses offered and a lot of facilities that right now the classrooms, the capacities are anywhere from an older building may only have 20% that we can sit in that, whereas some of our newer facilities can be up to 50% and maintain good social distancing and a healthy and safe environment. That took a lot of effort to remove all the classrooms, make sure that the seats were spaced appropriately. And so that was put together all summer. And then our colleagues, our faculty and all of the colleges put together their best plans for the different modalities and ways that they could teach their class, and thinking in creative and innovative ways to try and provide the best options. And so you'll see that you probably have a mixture of modalities. And so we have our face-to-face and traditional options. We have hybrid options, which means there's a portion that'll be face-to-face and a portion that is going to be online. A lot of the hybrid options also are coming because of the seating capacity. So you may have a class, a lecture that's 100 students, but the classroom that it's in, to be socially distanced, can accommodate about 30. So that would be hybrid, where there's a different attendance model. So a student may be in class Monday and then through Echo 360 looking at, live stream or through Zoom on Wednesday and Friday. And so one day they're face-to-face when two-thirds of the class are at home, and they switch. And so you'll see some of those, and those will be identified, the hybrid models, in Canvas or on your syllabus. So we've spent a lot of time doing that to make sure that you have a great experience and some opportunities there. And we're, like I said, really excited. We're getting through some of those final adjustments and changes with the course offerings. And so those should be kind of stabilized by the middle of this week. And from there, we will hopefully, like I said, if everybody follows everything that we've said here. I think the biggest piece is that if everybody follows those rules and keeps your masks on and socially distanced, we want to be here all year. And so that's one of the ways that we can accomplish that. And so the more compliant we are in that way, the more we can have those options of seeing each other, working with each other, and having those kind of face-to-face opportunities to build relationships, as well as continue to grow in different ways to build relationships through our online interventions and engagements. So thank you.
Hi, everyone. My name is Michaela Taylor, and I am the Director of Graduate and Professional Student Affairs for Student Government, and I will be co-moderating along with Courtney. I first wanted to thank all the panelists for being here and for sharing your introductions with us today. I also wanted to let everyone know that UKSGA will be live tweeting this event. You can follow along with the live tweet and also ask questions, and we will try to get to as many as we can. So with that, I'd like to start off our Q&A portion of the panel with this first question, which is, if a student notices non-compliance on campus or off campus, what are the steps for reporting that? And then is it anonymous? And what steps can they take? So I'll open it up to the panel.
I'm happy to take that question, Michaela. I think a student's going to have a couple of different options for reporting noncompliance. Again, we have set up two different communication modalities, phone or email, to our UK Health Corps. So again, 859-218-SAFE or emailing at healthcorps@uky.edu. We also have our Office of Student Conduct that has a public report form. And so that individuals, not just students, but faculty, staff, and community members can submit a public report using their online link, which can be found on the Office of Student Conduct's website. As it relates to that question of can someone report anonymously, the answer is yes, but that will sometimes limit the Office of Student Conduct's capacity to gather appropriate information and potentially determine if there's a violation. And so when you report anonymously, it just means that the office is not going to be able to have any follow-up with whoever that submitter is.
Thank you, Nick Kerwal. We had a question come in from Twitter. What was the purpose of the tents on campus? I will open that to the panel.
Yeah, I'm happy to answer that as well, Courtney. I think, as I think was just discussed, related to our indoor capacity, whether it was in an academic classroom or in dining or other facilities on campus, we understand that in order to be physically distant, it's going to significantly reduce our seating capacity, right, in terms of our buildings. And so adding these tents is just an additional way that we can increase our capacity. So again, allowing more opportunities for students to stay on campus and be physically distant. And again, sort of really living into that idea of how do we make, sort of compliance, how do we make it easy to comply with these health behaviors?
Thank you. Our next question is students, they come to class and they're healthy, but inevitably someone might get sick, or there might be some pandemic related crises that they are faced with. So in that case, what is going to be the protocol for students in this situation to ensure that they are receiving an equitable education experience?
So we've spent a good amount of time this summer, not only looking at the spacing, but also of the classroom and capacities, but also making sure that technologically we have everything set up so that it should be able to seamlessly manage issues like that. So Echo 360 has been deployed and implemented in a number of rooms across campus, which allows for lecture capture. So as the faculty member is speaking, the lecture is captured with the PowerPoint and the speaking over it. So if somebody is ill and needs to quarantine, that's absolutely something that they can continue up with their studies. And then there's, so from an academic standpoint, that's one of the ways that we can assist with that. And then there's a host of other supports from student affairs and other people on campus in terms of making sure that all of their needs are met.
Thank you. Another question we had is, what is the visitation policies for student families? So for example, if a student forgets something and they want their family members to bring it back, what would the policy be?
Yes, I'll take that. That's a good question. So parents and families are allowed to visit their student within the residence halls at any time. So there's no restriction on their ability to be able to visit any students.
Thank you. So students are wondering what COVID positivity test would be a concern for UK. So at what point after the initial testing, what is the positivity rate that would be concerning for UK officials?
I can take that. We at UK are working with our START team led by Dean Bob DePaula and made up of a team of medical professionals, and there isn't one trigger point. So they're meeting regularly, if not several times a week, looking at a whole host of variables and coming together as medical professionals to make a recommendation and to provide a review to the senior administration. Some of those variables include what the positivity rate, but it also includes the capacity in our hospital for the ICU and for beds, the capacity of PPE, of personal protective equipment being available to people, our capacity to actually offer a residential experience given the workforce that would be available to teach, to provide support in the residence halls and across student success areas. It would also absolutely include what our local, state, region, and federal regulations and recommendations from officials. It's a whole host of different variables that team led by the medical expertise on campus would be reviewing to decide what would necessitate a change in our plans.
Thank you, Dr. Turner. So when a student on campus tests positive and has to quarantine, how will that process work? Further instructions from the university staff is not enough. I need to know if I should have 2 weeks of clothing, toiletries, entertainment, etc., and what that process might look like.
Yeah, I'm happy to talk a little bit more about the details. Again, for a student who tests positive and has to, who tests positive on campus, who lives on campus and has to isolate. So we have some isolation facilities on campus where we would ask a student to potentially stay again, or a student could choose to go home. And again, we've tried to think about all of the various things that a student may need. And so even how does a student get from their residence hall to the isolation home? In terms of having care packages in the rooms to make sure if it's, late at night, basic things like, just some snacks and water. We have prepared for a process for allowing laundry service to be done during that process, realizing that it may be, again, multiple weeks. Again, we have worked with our UK dining partners to think about meal delivery. In terms of entertainment, and we actually faced this in our spring semester. Some of those things are really hard to anticipate. And again, some of that is the responsibility of our wellness connectors. And so our wellness connectors, in terms of following up with students just to see what they need, that will occur on a semi-regular basis, whether that means every other day, just to check in and make sure that students are doing okay. I think, as we've talked about before, from a technological perspective, and I think what was asked, which is, for students who still have the capacity to continue in their coursework, who feel well enough to do that, how do we make that easy, in terms of Wi-Fi and having access to ongoing courses through sort of online modality, or again, do they need some sort of device to be able to continue to do that? So those are just some of the various things in terms of having an initial follow-up call with our wellness connector that we will go through. But we have tried to design thinking, like I said, about transportation to going to an isolation space, thinking about food, thinking about laundry, thinking about the technological needs, thinking we will have students who have existing medical conditions. So thinking about things like prescription medication and how do we make sure that, again, students can continue that level of care as well. So all of those things will be part of the sort of follow-up process that our wellness connectors play within the UK Health Corps.
Thank you. So as we know, all students are required to be tested before coming to campus. And with those guidelines in place, students are wondering what the guidelines and policies are for faculty and staff that are coming to campus.
Faculty and staff are able to be tested whether they have symptoms or are asymptomatic. The START team, again led by Dean Bob DePaula and a series of medical experts, did not recommend that all faculty and staff be tested, but based on a lot of different student voices as well as faculty and staff voices, the institution made a decision late last week that it is available to all faculty and staff to be tested if they so choose. The START team didn't find that it was needed for faculty and staff to be tested because they all are already in Lexington. Their rate of infection is already calculated within the wider population of Lexington, whereas students, they would like to have a baseline to test all of them since they will be coming from all 50 states, all 120 counties, and from around the globe. And so since 30,000 plus students would be descending on Lexington at one time, having them all tested initially to get a rate of infection, which their numbers would not be in the current Greater Fayette County rate. That was the recommendation by the START team to test the students. But in response to lots of student voices, lots of faculty voices, lots of staff voices from across campus, the institution has now expanded its testing to include faculty and staff, whether they're asymptomatic or symptomatic.
Thank you. What will happen if a student does not complete their daily screening or does not receive a COVID testing before coming to campus?
So I touched on this a little bit before, but in terms of completing the daily screening, again, we're going to have some automated communications that continue to remind students to do that. Again, we will have follow-up calls asking students to complete it. Ultimately, after a period of time, those cases will be referred to our Office of Student Conduct within the Dean of Students office. As it relates to initial testing, again, it is a requirement for face-to-face instruction and in terms of living on campus and being on campus. We are cross-referencing that data and so that we will be continuing to communicate to individuals and students who haven't yet registered or haven't made an appointment to do their initial testing. And then ultimately, at the end of our initial testing on August 22nd, again, after repeated attempts to follow up, repeated reminders to do it, we will ultimately refer those cases to the Office of Student Conduct and basically ask individuals to go to an alternative modality for the fall semester.
Thank you. So we've heard a lot today about the UK START team and the different medical professionals here at UK that have endorsed this plan, but are there any independent public health officials who have endorsed the UK reopening plan?
I can answer that. And I will just say that I don't believe anyone has specifically addressed the UK plan. What there have been are general comments on how to best and safely reopen campuses. And UK is doing all of those things. So having everyone tested in advance, the daily screening, all of those things are what are recommended to help ensure that institutions of higher ed can stay open during the fall.
Thank you. What are the policies in place to regulate club meetings and fraternity and sorority life?
So the institution has offered some guidance around events. And so again, I know that is put on our university events website and been communicated out to the larger community. I also know our student organizations and activities office has recently communicated that guidance through BB Involved to every organization president or organization lead, as well as those organizational advisors. And so again, much of that guidance is related to a lot of the things that we've talked about this evening related to healthy behaviors. And so how to have an event in terms of having physical distancing, appropriate signage. One of the major requirements is that at events is that you have to, have the capacity to take or track attendance. That's certainly really helpful if a student were to be positive in terms of the contact tracing and following up with people who are potentially exposed. It requires a managed point of entry and a point of exit. I know there's also guidance related to, the no open food or beverages and other things. And so again, that has currently been published on our university website. I know there's been a lot of resources and the staff within student organizations and activities have provided a lot of guidance to our groups and organizations. I also know that's been communicated to our academic colleges, again, with those groups and organizations that might be embedded within colleges. And similarly has been followed up by our fraternity and sorority life staff with those respective groups.
So students who will need to be in isolation will be going to the University Inn. So we were wondering what will happen when University Inn, which has a capacity of 65 residents, fills up.
So I'm happy to answer that as well, Michaela. I think actually we have multiple facilities on campus that we've specifically designated for isolation. I think related to an earlier question around, the sort of idea of is there a sort of positivity rate or how do we assess, the university's capacity to stay open? I think as we look at the number of students who need to isolate and what our isolation capacity is, that would be an additional factor for the institution to consider as we think about our ability to stay open this fall.
Thank you. I will give you a break, I promise, this go round. Will scholarships be honored for students who don't feel it's safe enough to attend in-person classes during the pandemic?
So we have basically an appeal process. So any student that has concerns, we'll just have them contact the financial aid office and specifically Office of Academic Scholarships, take the information down and we review those, and we've been getting those and making determinations as we can. If the scholarship is also in partnership with the college, we'll consult the college based on the concerns. And we may also look at, are there modality shifts or other things that could happen that would still make it tenable, and so work through those on a case-by-case basis, but yes.
Great, thank you. In terms of residence halls, are kitchens and laundry rooms going to be open this semester, and what will be in place to ensure social distancing if they are?
Yes, kitchens and laundry rooms will be open inside all of the residence halls. There's also signage within all the spaces that have capacity on them. So students will be aware how many students are allowed in each one of those spaces. For the most part, as of right now, we are asking that there's only 2 in the kitchen at one time. And then the same for our laundry rooms. There's also going to be cleaning materials within each one of those common area spaces. So as students use it, you just wipe it down shortly after you're finished, and then after that, leave it for the next student to use. So both will be open.
Thank you. How is UK working to ensure that decisions are made with a high degree of transparency?
Since the beginning of this process, the institution has tried to be around the idea of a big table. And we've had over 500 faculty, staff, students participate in a whole host of work streams. We've tried to make sure that there's representation from the different elected bodies, whether it's Staff Senate, University Senate, or SGA, on these different work streams, as well as from different groups and different colleges and across the campus. We continue to pivot and change as more voices come into the conversation and ask to be a part of the process. We have tried to be through an ethos called more is more in terms of our communication, and been providing more information to the wider community at a stronger interval than ever before, in terms of using different media channels and information out into the community. All of those principles, from what we started to how we've learned and morphed throughout the process, continue to stay with us as we move forward. Personally, SGA President Courtney Wheeler and I have talked about if there are any decisions to be made that would impact the modality going forward, that as it relates to the student voice and to the student interest, that she would be at the table immediately as those discussions got underway.
I think we'll switch it up and take one question from our Twitter. So a student asked if there is a quarantine requirement is there a quarantine requirement before receiving test results? So before you come to campus to get your test results, is there a quarantine requirement?
So I can answer that question. Actually, sort of aligned with Governor Beshear and what the Commonwealth has done in terms of giving some travel advisory. So for students coming from locations that have seen high positivity rates, again, we've really communicated out and asked those students to, again, please get tested before they arrive. But again, if they can't, that they get tested immediately upon arrival, and that we're just recommending that they self-quarantine. Again, how are we making that easy? Is that we've sort of automated meal delivery. And so some of those locations that have been articulated by the Commonwealth include places like Florida and Texas and Alabama. And so again, we've just tried to be proactive in meeting the spirit of the Commonwealth in terms of how we best keep the campus safe. And again, it's just asking those individuals to self-quarantine until they get their test results.
Thank you. We have another question from Twitter. Is UKPD in charge of enforcing the student code of conduct when off-campus events happen?
So the University of Kentucky Police Department doesn't have jurisdiction within the city of Lexington, and they have some jurisdiction as it relates to properties that are adjacent to, but really that response will come from Lexington Police.
Thank you. So as students are starting to receive their account statement, some may notice a distance learning fee. So I was wondering if you could talk a little bit about that fee, why it's being assessed, and why so many classes changed to online.
Certainly. So the distance learning fee is actually a fee that we've had on the books for a number of years. I'm actually currently in my PhD or my doctoral program, and it's been totally online. And so that's been a $10 per credit hour. And so when reviewing all of the tuition and fees and trying to do what was best for the institution in totality, the initial piece was looking at the additional charge and how that could increase tuition with some of those changes in modality. And so that's where the tuition and mandatory fees cap came on. However, the course fees and the distance learning fees are fees that are associated with things that need to be purchased or done to support students' efforts, both in the classroom and in remote learning. And so when we talk about some of the updates in Echo 360 and other supports that are there, as well as the staff that support distance learning, all of those are funded through the fees. As I mentioned earlier, relative to the shifts, and while I think, the timing of it is a little bit challenging, and I will say it was quite an endeavor to take all of those sections and have faculty feedback on individual sections and look at the classroom sizes and kind of put that whole puzzle together. But the primary tenets of the kind of rationale for the changes and why some of them came later are relative to kind of as we were placing those portions together and seeing what would work best, first and foremost, the health and safety. We've talked a lot about the university being committed to protecting our students, our faculty, and our staff. And so some of the modality changes that happened more recently were really connected specifically to that health and safety. So for example, fine arts had some movements that were predicated because the health guidance on loud speaking and singing. And so some of those courses that are in the performing arts and theater and vocal and even in music made sense to move those online or hybrid with a differential attendance model in some cases. And then also because as we got closer to the time, as faculty were looking at their courses, clearly there are some where it is a better, because of their own concerns, to have an online modality. In those cases, we tried to balance offerings within those sections by other faculty members who could have a face-to-face option or a hybrid option so that students might have an option to choose and switch sections or change courses. The other factor is room limitations. Again, as we talked about, to be able to keep the health and safety paramount, social distancing, having the space for students to come in and out and be sitting like we are today with enough room to feel comfortable according to the CDC guidance. As I mentioned, some of the classes and our facilities could only accommodate anywhere from 20 to 50% of what they typically did. And so in order to do that, larger classrooms had to move to maybe a hybrid model with differential attendance. And just so you know, from traditional model or a face-to-face option, for the traditional, any class that has less than 50% online is considered a face-to-face option. Once you get over 51% online, then it goes into that hybrid option. And so while some in their mind, faculty were saying, okay, we're going to be traditional, that quickly moved to face-to-face when we looked at the rooms, and a Monday, Wednesday, Friday class then became something where only 30 of the 100 could be in there on any given day. And so that alternating attendance or a flipped classroom model, both in synchronous, meaning that it's happening and you're listening at the same time, or asynchronous where it's recorded, were happening. And the last piece is that there are also considerations given to, in this time, what is the best approach pedagogically for this kind of course? So you think about, for example, language courses. Foreign language, there's a portion where reading the lips and seeing how the words are coming out and being able to understand is maybe best taught when not wearing a mask. And so the mouth movements and explaining how to properly pronounce, vocabulary is critical. And so that's where some of those shifts might have happened later, as there really was a good amount of thought from the faculty as to what's the best approach to deliver this. Also, small group discussions and how to make sure that we could adapt in different ways. Some of those decisions really predicated the modalities. Again, I will say that it was a pretty heavy lift, and so the timing wasn't, we're still working through some of those as those adjustments are happening. And but like I said, we're coming to a place where we should have everything settled in the next couple of days. And so again, if students are looking at their current modalities, have any questions or concerns, the first point would be to reach out to your advisor and work with them to see if there are other offerings that might be available to you.
Thank you. And thank you to all of our panelists tonight. We're going to end with one last question. After the initial round of testing, will students have access to free testing on campus through UK, UHS, or Wild Health?
I guess I get to answer that. Yeah, for our students that are paying our student health service fee, they will continue to have access for testing through, again, University Health Service. Again, depending on, as we think about what our testing needs, again, that might additionally include a partnership with Wild Health as well. But the answer is, in general, yes, in terms of paying that University Health Service fee.
Thank you all so much, and we really appreciate you guys being here tonight. And continue to check out the Twitter at UKSGA to see if any of your questions were answered on there tonight. Thank you all.